Cardiovascular disease is the #1 killer in the United States. What if I told you that you have a tool in your kitchen right now that could drastically decrease your risk of death from heart attack or stroke? Would you run to the cupboard and take a shot? That might help you. I'm Dr. John Bartemus, DC, and I'm putting the pieces together to help you live a life at optimal. We all know someone that's died of a heart attack or a stroke suddenly and without warning. Well, what caused that to come on all of a sudden? Sometimes it's a blood clot. The fancy name for blood clot in medicine is thrombosis. And the way that a blood clot causes a heart attack is the clot can clog an artery that supplies the heart, and then that heart tissue dies, hence the heart attack. The way that a blood clot can cause a stroke is it blocks one of the arteries to the brain and leads to the death of brain tissue. So that's the mechanism of a blood clot causing heart attack or stroke. Well, what factors contribute to blood clotting, or platelet aggregation as it's called? There are multiple, but a couple I want to focus on today are those that are happening day in and day out in me, in you, and in everyone who eats meals. Eating a meal leads to increased platelet aggregation or increased clot formation. So when we eat a meal, that meal leads to increased platelet aggregation, meaning the platelets in our blood aggregate or come together in a group, which can lead to clot formation, and that clot could lead to blockage of an artery in the heart or brain and lead to a heart attack or stroke. So natural physiology after we eat leads to increased clot formation. Well, another question we could ask is there a rhythm or a time of day when clot formation is higher? And that answer is yes. The time of day where clot formation is higher is 6 a.m. Why? We'll dig into that in a second. But look at this right now. The research shows that many heart attacks and strokes occur after a heavy meal and or in the morning. Well, look at this. After meals, we have increased platelet aggregation, and at 6 a.m., we're at our highest risk of platelet aggregation each day. So what is the uniting factor here? Well, there's a lipid in your body, a form of cholesterol called HDL. If you've ever been to a yearly physical, you know your doctor has run your labs, looked at a lipid panel, which includes your total cholesterol, your LDL, which is called the bad cholesterol, and the HDL, which is called the good cholesterol. Why is HDL the good cholesterol? Because it's known to go and scavenge cholesterol and pull it out of the bloodstream and take it to the liver to be dealt with. LDL is called the bad because it takes cholesterol from the liver into the periphery, into the vessels. So HDL is good because it helps pull cholesterol out of the vessels. Well, HDL levels are dictated by an apolipoprotein called apolipoprotein A4 and others. But apolipoprotein A4 in the research has been shown to decrease platelet aggregation. So what we could do is by increasing our ApoA-IV levels, we can block platelet aggregation. So the question would be, how do we increase our ApoA-IV levels? Well, ApoA-IV levels are lowest at 6 a.m. each day. So this is the association between ApoA-IV levels and increased clotting at 6 a.m. in the morning. Research has shown that's when ApoA-IVs are lowest. Research has also shown if we can increase our ApoA-IV levels, then we have decreased clotting, not only at 6 a.m. in the morning, but postprandially or after a meal. So increasing ApoA-IV levels blunts the effect post-meal of promoting clot formation and inflammation, etc. So we want to increase our ApoA-IV levels during the meal and throughout the day to help prevent clot formation and prevent heart attack and stroke. Well, how do we do that, Doc? Well, I'm glad you asked, and this is where your kitchen comes in, because all of us, I would bet, have this ingredient in our kitchen, and if you don't, you need to go get it, because it increases ApoA-IV levels, which leads to increased ApoA-IV. So what is EVU? EVU is extra virgin olive oil. Extra virgin olive oil has been shown repeatedly in the research to boost ApoA-IV levels, which decreases platelet aggregation or clot formation and decreases risk of heart attack or stroke. So if you're looking to decrease your risk of the #1 killer in America, then you want to increase your intake of extra virgin olive oil. Now, how should you do it? Well, this is where it's nuanced to the person in front of me, and we need to get specific on an individualized level. But in general, you can add extra virgin olive oil to your meals. Extra virgin olive oil should not be a cooking oil, because once you take it above medium heat, you're turning it into, you're oxidizing it. Sorry, I was looking for the word. You're oxidizing it and converting it to a trans fat, so now it's hurting you. So you shouldn't cook extra virgin olive oil above medium heat, and really it should be looked at as a condiment, not a cooking oil. So using it on salad dressings, mixing extra virgin olive oil with some balsamic vinaigrette and some red pepper flakes or chili flakes makes a great salad dressing. A friend of mine and I have done shots of extra virgin olive oil. How do you choose a good extra virgin olive oil? Well, one that has some burn to it after you swallow it. There's a couple second delay, but if you feel a burn in the throat, some people think that means it's a bad oil because it's rancid. Actually, what that is the polyphenols in there creating the burn, so that helps you know it has high polyphenol content, and the polyphenols are what promote the anti-inflammatory content and the antioxidant content of the extra virgin olive oil. So, wrapping it up, if you are at risk of increased heart attack or stroke, especially in regards to increased clot formation, then increasing your ApoA-IV levels is going to be key for you. And the way to do that is to increase your intake of extra virgin olive oil, particularly around meals, so that it blunts the meal-induced increase in clotting and therefore decreases your risk of heart attack and stroke.